Good evening, everyone. On the behalf of Team Dentist Channel Online, I would like to extend a very warm welcome to all of you. I'm Dr. Aditi Mishra, and I'll be the host for today's session. On to, and today's topic is Pathway and the Road Ahead of Dentistry, a Surgeon's Perspective by Dr. Monica. So before starting with the session, I have few housekeeping notes for everyone. If you have joined us from Facebook and YouTube Live, you can ask us questions by commenting and we'll be answering them at the end of the session. If you have joined us here on Zoom, you can drop your question in the question and answer box and we'll be answering each and every question at the end of the session. So without further ado, I would like to introduce our today's speaker to everyone. Dr. Monica Surana is MDS and she is a Gujarat-based maxillofacial surgeon and consultant at the aesthetic clinics, currently undergoing specialty training in facial plastic surgery and cosmetic surgery. She has the mindset and skills that are prerequisites for any great surgeon, especially the ones who operate in and around the face. She has the eagle's eye for suggesting appropriate and patient centric treatment options in the best interest of the patients. She has a keen interest in surgical and non surgical modalities to treat patients pertaining to maxillofacial and cosmetic interests. She has done her BDS and MDS in oral maxillofacial surgery from KM Shah Dental College and Hospital, Sumandeep Vidyapeeth, Vadodara, Gujarat. She was a gold medalist in her BDS as well. She has done observership and internship at GSR Institute of Craniofacial Surgery, Hyderabad. She has also undergone training in head and neck oncology from the Gujarat Cancer and Research Institute, Ahmedabad. Welcome, Dr. Monica.
Uh, Thank you, Aditi. Thank you for a very nice introduction. I would just like to say that when we had discussed to further go on with this webinar, I was into my fellowship and I've just recently completed it a few days ago. So yeah,
Congratulations, doctor.
Thank you so much. So I'm practicing in Gujarat cities and even in Mumbai and in and around Maharashtra. So without wasting a lot of time, let's just start with the presentation.
Yes, please.
So the topic is pathway and the road ahead from a surgeon's perspective. So as you can see that the image which has been kept is very strategically kept because as we imagine surgeons, we imagine male surgeons.
Yeah, but webinar, I mean, I have started the webinar.
Hello. Yeah. So this topic was very important to me to just talk about in general about my journey for the last 12 years and how I began and how I've so far completed my journey to become a surgeon. And I'm still learning, I'm still doing my fellowships. I recently completed one in fellowship in facial plastic and cosmetic surgery, but the road has still just begun. And as you can see that it's a bumpy road. We still don't know, I don't know myself that where I'm going to land in next 10 years. But yeah, so far so good. So I'm a maxillofacial surgeon. I have done my fellowship in facial plastic and cosmetic surgery from the Aesthetic Clinics, Mumbai. And it's a 1-year fellowship. And I'm also an implantologist. So basically my keen interests are everything and anything around face. And my fellowship was a combination of facial plastics and cosmetic dermatology, which has given me an insight into skin, hair, and face and how a plastics point of view would come into a maxillofacial. So amalgamation of both my residency and fellowship has taught me what I am today. So during my 12 years tenure, these are some of my achievements that I was the youngest speaker recently at the 45th annual conference, national conference organized by AOMSI in Bangalore. And I have achieved a resident membership in Academy of Cosmetic Surgery, which is a prestigious American academy, which has its own fellowships of 1 year. And I have been humbled by given the opportunity to be speaker at national and international platforms. So this topic, pathway and the road ahead of dentistry, a surgeon's perspective. So in general, when we think about dentistry, we think about only the 9 branches. Either you go for oral implantology, which is upcoming as a different branch altogether, which is basically an amalgamation or a combination of the skills of prosthodontics, periodontics, and and oral surgery. So it is upcoming as a different branch altogether. Then we have conservative and endodontics. In that also now there are two different, those who only practice endodontics, those who specialize in only the RCTs, those who only specialize, super specialize in single sitting RCTs, and even the re-RCT cases. Then we have forensic odontology, which is not a branch as a postgraduate in dentistry, but it is a side branch which is upcoming as a different entity in itself, which is important in and has a lot of medical legal aspects entailed to it. Then we have periodontology, orthodontics, public health, and pediatric dentistry, and maxillofacial, prostho, among the other branches. So how do one decide, first of all, that coming into dentistry is the right path? I mean, there could be thousands of questions, and we are just boggled by all these questions, knowing nothing about what one branch entails. Of course, it helps if you are from a medical background, but if you are not, then you have just the iceberg or tip of the iceberg knowledge of what it actually is. And it becomes difficult in those times to even choose whether to go for BDS or to go for MBBS, and what actually, why are we going into these fields? We don't know. Somebody may be a doctor in your family and they must have said that, okay, so this is the field, you must go for this because it has high value, suppose general surgery or general medicine. But we forget that it is an individual's perspective what you want to do. So for me, instead, for instance, I did not want to go for an MBBS, but my main interest was just the face. So I chose BDS, I chose dentistry to get into facial plastics. That was an 11 or 12 years dream which has just begun. I have just taken one step into it, but it took me 12 years to achieve that. And I did not know how I would achieve it. I did not have a pathway, or I did not even have a step-by-step process or a formula or a program given to me at the beginning when I chose dentistry. So yes, I was just unaware, but I had one thing in my mind, that this is something which interests me. This is something my mind works towards. Having an artistic mind helps, but having a scientific background and scientific base to it helps you much better. So the BDS, I entered into BDS in 2011. It was a 5 years long journey. And in that, I remember that out of 100 class, we only had 20 females, and 80% is just guys, which is also the scenario nowadays, given that NEET has cut down to 8 from 100, we just have 50% of admissions. But still, the ratio of male to female or a guy to a girl, I don't want to get into the specifics because I hate that we generalize it into guys and girls. But yes, still in dentistry, we see that there are less number of girls initially, and then which is just the ratio all over across the globe. So it was a 5 years long journey. And during my BDS, I understood that my keen interest out of all the subjects was in anatomy in first year, then pathology and oral pathology in the following years. And in final year, when I came into my third year and final year, as I started understanding maxillofacial surgery, everything was falling into place. So remember I said that I wanted to do something on the face, something on the cosmetic side. That was my mindset, but I did not know how to get to there. So it was just as if something was guiding me, that, okay, so this is anatomy. Anatomy is the basis of all the surgery. That was interesting. I found it interesting. So I kept moving ahead. Then came the maxillofacial surgery in final year, and that was it. So I knew that this is it. I'm going to go into facial plastics through maxillofacial, because we deal with the face all the 3 years in our residency. So people call it that we are still dentists, because there is a little bit of unawareness among the other branches. But in my fellowship, I have seen that my maxillofacial knowledge was helping me and is still helping me to be apart from other branches who are getting into facial plastics. So in India, as of now, there is no branch which is, or a super specialization which is called as MCH facial plastic surgery or a facial plastic and cosmetic surgery. So that is why these fellowships are coming into place, which is helping us achieve that. In foreign countries, in US and everywhere else, you have uh, segregated courses which you can apply, or maybe government institutes where you can apply for these courses, but not in India. Especially coming on to recent times, DCI has just announced that yes, MDS maxillofacial surgeons are eligible to practice facial plastic and cosmetic surgery, and especially hair transplant, because it is in our curriculum. So that opens a new pathway. This was a long run battle which was going on for years and years around. And this was a similar battle, and it is still a battle in some of the places for maxillofacials to get into oncology, because we are still treated as oral oncology, not as craniomaxillofacial or craniofacial surgeons. This is still like some of the places, they, when we go for jobs and everything prospectively, we are given a second preference. Why? I don't have an answer, but I know that there are paths that we can go on and still achieve what we want to do, and there is no stopping for us. So this was a journey, BDS, how I realized that I'm going to get into maxillofacial surgery. So fortunately, I was bestowed upon with the gold medal for the 5 years, and I was a gold medalist in my BDS curriculum. Then came the maxillofacial or a oral maxillofacial surgery branch, which was an MDS for 3 years. That time also in MDS, now you are getting into specialization. But in each of these 9 different dental branches where you go for super specialization, you have super specialization, in the sense that even in maxillofacial, you have PMJ disorders, people who are just treating PMJ disorders. After residency, they are getting into fellowships and further trainings. There are people who are only doing oncology. There are people who are only interested into trauma and the general max facts or the pathology. There are people who are getting super trained into clefts and craniofacials and orthognathic. And facial plastics in maxillofacial and in dentistry is just upcoming. There are hardly few names to name a few of the eminent speakers and persons who are working, because this branch all over India and maybe outside India globally is run by oculofacial plastics, or by ENT specialists, or by general plastics who get core into some of the facial plastics. But facial plastics in general is an amalgamation of all the different branches, and somebody or the other is just finding a way to get into facial plastics, be it ENT surgeon who's working here, ear, nose and throat, getting into Botox, getting into fillers, getting into blepharoplasty, or somebody from an ophthalmology residency getting into blepharoplasty or jaw surgeries or orthognathic surgeries, or a maxillofacial who has been dealing with the jaw and the teeth and the occlusion and the bones in general for the last 3 years, getting into hair or skin or pigmentation disorders. So all in all, there are a lot of branches running around facial plastics, and there is no one way that you can get into that. But yes, dentistry definitely is one of them, which is now being realized and upcoming, and people are getting into max facts to get into facial plastics just like me. So a lot of surgeries was given, and I had a good 3 years. Then came the fellowship of 1 year. So in India currently, there are literally only few institutes or few private clinics who are giving a 1 year fellowship. Now, why 1 year fellowship is important? There are also courses, hands-on, so-called hands-on courses, which give you 2 day or 3 day training. That's not enough. Imagine somebody who's into 3 years of facial, 3 years of maxillofacial, or 3 years of ENT, or 3 years of ophthal, or 3 years of dermat. Still, all these aspects are not interlinked. Meaning, in facial plastics, you don't have a residency. So how can you finish what 3 years would do in 3 days? That's the question. So in India, there are only 2 or 3 institutes, one of which is from where I did, that is the Aesthetic Clinics, Mumbai. The other one is somebody who's associated with DY Patil. It's also a deemed university affiliated fellowship. Then globally, you have American Academy of Cosmetic Surgery and among others who provide, but still for a maxillofacial coming from a dental background, just to namesake dental background, because yes, we learned our artistic skills, we learned our carving skills, and those help. So I take pride in saying that dentistry taught me how to measure 1 mm or 0.5 mm with through my eyes. I don't need a scale for that because we have been carving throughout your first year, second year, and that helps. You can measure 0.5 mm through your eyes because that's what teeth carving taught us in the first year. So coming on to my fellowship, it was a fantastic 1 year. I had the best time of my life so far. It was grueling, but it taught me a lot of things. It made me who I am, and it has changed and transformed me into a better person professionally, personally, and it has changed my mindset. Why it is important? Because you have an interaction with the mentors who have been practicing for 10 plus 15 plus 20 plus years, and that knowledge you really cannot get into one less than 1 year. 1 year is just a stepping stone. I mean, you are just getting into facial plastics. So yes, I got a lot of cases for surgical, which is blepharoplasty, ptosis, rhinoplasty, hair transplant, and lasers, peels, botox, fillers, just to name a few. It was an amazing, fantastic year. So I was also fortunate to be invited by AOMSI in the last conference, which was in Mangalore, to give a talk. And the topic which I presented was also interesting. That was under the scalpel or under the needle, whether you would go for a surgical or a non-surgical procedure to enhance your facial features or for facial rejuvenation. And so this is my 1 year fellowship. Those are my mentors, Dr. Debra Shum and Dr. Rinki Kapoor. And I really take pride in saying that, yes, I was trained by two of the best persons uh, in the field. So all in all, I did not know how would I land up into the fellowship. I did not know. I mean, nobody knows if you're not so sure. And there is no guide as such given to anybody. Okay, step one, do BDS. Step one, do MBBS and go into blah, blah, blah. All those things are not written anywhere on the planet. So you have your own path. You just take the first step and then you just move on. So these are just jigsaw puzzles of your life. I mean, you could end up doing for after dentistry, you could just go on for forensic odontology and get into some good government jobs where you are solving some criminal cases. Dentistry helps there because teeth are the only thing which cannot be decayed through fire, through XYZ means, even the hair. So yeah, that helps. And you could even end up for cleft and orthognathic, or you could serve in a government organization, or you could do an MBA and start your own academy. So there are a lot of opportunities. It is not just constrained to dentistry and what next. Dentistry is a pathway. You could just further do whatever you wish to, wherever your interest takes you. And you could, there are 5 years which you have in hand to figure it out. There are people who just give up dentistry and are into academics and just teaching, maybe on YouTube, maybe in an organization or a college, but that is their passion. So find out what your passion is. If your passion is to get into research, get into papers, doesn't mean that you have to get into public health. Yes, it helps really well, but your clinical aspect also helps. So maybe you could be an endodontist and get into just research. That is also your pathway. So 2021, 2022, and so on, these years are just gonna come up, and one has to figure it out one step at a time. So currently I have completed my fellowship. What next could be I can get into another fellowship. What next could be I could start my own consultation. What next could be I could start my academy. What next could be I could start training others. So the pathway could be step by step ladder. You first gain knowledge, then you spread knowledge, because spreading knowledge is also going to help you upgrade your knowledge. So the upcoming ventures I am into is something which we started during lockdown, during second wave, when all the colleges were shut, and only online classes were going on. And we found the lacuna where the classes were not taken and people were just not interested in Zoom webinar classes as such for 3 or 4 long hours a day. So we started something called as DentGyan, which was an interactive class, one-to-one lectures, a very limited audience for the dentistry from first year to final year. Each of the subject, each of the chapters were covered. Recorded lectures were given to them. One-to-one interaction was done, and a post Q&A lecture and a test was also conducted. It was done. It was started as a venture by me and my colleague, Dr. Aditi. And then because the classes again started happening offline, we just thought that it is best to stop it for a while. But obviously, we still have our classes and inquiries going on. So if anybody is interested into learning dentistry from the specialized people from all the branches, 9 branches, you're welcome. So this is something that we started: anatomy, physiology, and everything, all the aspects of all the years. So the other future ventures I'm currently working on is trainings, academic teachings, clinical upgradation, as in clinic insights. Because even in PG duration, we are not taught so much about the clinical aspect in real life. So if somebody is interested into training, somebody is interested into learning Botox and fillers, somebody is interested into academic teaching, they're most welcome to come to us, or just follow up on the given details in the next section. So all in all, what I believe personally is there is no right or wrong way if you are on the way. As long as you are on your journey, one day you will reach your destination. The important aspect is to keep on doing, keep on hustling, and keep on moving and keep dreaming. It's like there's something in Hindi my dad used to tell me that एम करना अच्छी बात है, बट ऊंचा एम करना अच्छी बात है. अगर तुम्हारा एम ही इतना छोटा है तो तुम कभी उस तक पहुंच ही नहीं पाओगे. सो एम हाई. And these are some of my details. You could connect to me on email, Instagram, Facebook, or just give me a message on WhatsApp. So I feel that our generation may be a millennial or Gen Z or Gen Y, and your generation could be Gen X, Y, Z, whatever. But it depends on you what you want to do. It doesn't matter what your background is, whether you are from a medical background or not. It doesn't matter. You should have your perspectives clear on what you want to achieve. The end goal should be in your mind, and you will one day achieve it. It took me 12 years to just start doing what I want to do throughout my life. And yes, I'm happy about my journey. So I would like to take any questions if there are from the audience, Aditi.
Thank you so much, Doctor. What an amazing journey, and it was absolutely worth knowing each and every step. So, before moving on to the question and answer session, I would just quickly like to introduce our participants and everyone to our organization. And meanwhile, I request the participants to kindly drop their questions in the question and answer box so that we can take up one by one.
Do we have any questions so far?
Yes, we do have.
Okay.
All right. So, this is our organization, DentistChannel.Online, with the motto Healthy Smiles, Wealthy Lives. We have come up with a brand new website, www.dentistchannel.online. So, I request all the participants to kindly do log into our website and find all the information which is relevant to our profession on there. So, we are on Facebook, Twitter, Instagram, LinkedIn, and YouTube, WhatsApp, and Telegram. We are proud to announce that we are the first digital dental media marketing company which is catering to academic, professional, and commercial needs of dental students, practitioners, organizations, businesses, and dental industry leaders. We offer several services and a variety of platforms under one roof and creating opportunity for everyone. And being a Prime member, you can avail a lot of benefits, out of which one is you will be receiving e-certificate containing one FDA Germany CPD or CE point, which is, and it is only for the Prime members. So whichever webinar you attend, you will be receiving e-certificate only to the Prime members, and it will be containing one international certification CE point. And the annual membership will cost you just 799 rupees. And if you're using my promo code, which is ADT100, you will be availing some discount on the annual membership price. So do subscribe to our Prime membership. If you have missed out on any details, and if you want updates regarding our upcoming future events, you can just send your complete name on the following number, and you'll be added to our broadcast list. And after that, you'll be updated regarding each and every upcoming event that we have. Our sponsor, Novamind GmbH, they have the innovative dental and healthcare solutions to ensure your success. So they have generic implants and prosthetic solutions. If you have missed out our live session, you can go back on Facebook and YouTube and check out our recorded sessions there on under the handle Dentist Channel Online. Okay. So coming back to Dr. Monica, so I have this one doubt. So see, it's been 3 years of practice, and I have seen many of my batchmates only have quit dentistry. They are now into some administration job, or they have completely, completely changed their profession. So they're no more into dentistry. So how to motivate? And a lot of people have this thing in their head that dentistry has no scope at all. There is the saturation has come, and you do come up with all these negativities, and it becomes very very toxic to when you're practicing. And so a lot of people are coming with this. So what are your thoughts for our participants, that how to keep themselves motivated, know that you have to work under dentistry, and it's a very good profession, noble profession.
So, Aditi, it's a very interesting question. And yes, people think, and in general, dentists and their families who have put their children into dentistry think that it's a saturated branch. But you tell me that if it is so saturated, there are more medical colleges than dental colleges, right? There are more BHMS colleges or maybe other branches than dentistry. Then why is only that people are talking about dentistry being saturated? That notion actually is just in our mind. That is the one thing. And yes, even in my class of BDS, 50% of them left dentistry. Some did MBA, some got into their passion, other passion, which was bakery. Some got into management, like healthcare management, and they are into hospitals. So basically, people do leave dentistry after 5 years. But you imagine, if you are from government job, then definitely you're not going to leave because you have been groomed and you have had your struggles. So you know the importance. But if you are from a management college or from a deemed college, you have invested 5 years. You have wasted one seat. If at all you thought that dentistry was so saturated, then why get into one? If you have got into one, then get into a mindset that I'm not going to stop at dentistry, because in earlier times, having the graduation only was so big. But nowadays, having an MBBS or a graduation in dental surgery is nothing. It's just like 12th. Because the education level, the level of specialization, and the level of upgradation into basically micro subjects, getting the knowledge of less and less and more. So basically that has got into a habit of thinking that dentistry is saturated. You get into dentistry to get to your end goal. It could be just doing single RCTs all your life. It could be just making amazing dentures. Even in India today, I am now not aware of somebody who's getting into dentures with the so realistic artistry work which you see on Instagram or foreign channels. Am I right? Then why just stick to acrylic and just the natural fibers, which just looks very artificial? Get into, so basically the aim is do what you love and get to something at the core. Then you would never think that dentistry is saturated. Those 5 years had taught us. So I said into my lecture that I can measure 0.5 mm through my eyes because I know I did my carving well in my first year. So those knowledges, I don't think other branches have. They would need a scale to measure that. And we would have been doing it through just our eyes. So it's not saturated. And people get into a notion because everybody's talking, oh, it's saturated. It's not.
Yeah. So, with this note, thank you so much, Dr. Monica, for coming with us and for this amazing session and enlightening us and motivating every one of us, and putting that fire in our belly that yes, dentistry has something to do, and we are so much into it, and that we have to invest our future into this. Thank you so much for being with us.
Thank you so much, Aditi, for giving this platform to me to share my perspectives and ideology. And if anybody would like to just get into academics, and if anybody would just like a guidance, I'm not 100%, but maybe my whatever 100% is could give you 10% of the pathway which you're looking for. So anytime if somebody would like to connect, you have my details. And thank you, Dentist Channel Online, for the platform. Hoping for connecting with you, all the participants, and your organization in near future.
Yes, absolutely. Thank you so much, Doctor. Thank you to all the participants. So, with this, we are ending today's session. Thank you and have a great evening ahead.